You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Oh, welcome everyone. This is the Public Health Entrepreneurs Podcast, and I'm your host, Dr. Huntley. I am excited that you have joined us today. I have a special guest that I'll introduce in just a moment, but just in case this is your very first time tuning into the podcast, on this podcast, we cover topics of interest at this intersection of public health and entrepreneurship. And I've been on this journey myself for a very long time. I have a lot of experience in healthcare and public health, and I've supported a lot of entrepreneurs along the way. My guest is no exception. I absolutely adore her, and you'll get to know why as we chat. Tamara Mason is joining me. Tamara, how are you?
I'm doing well, Dr. Huntley. How are you?
I'm doing well. I absolutely, now this is just because we have video here, and I just noticed you always wear the most fabulous earrings. So I love your earrings.
Oh, thank you.
We go way back professionally and even personally. We have a little overlap there. I know that I was honored to be able to support you and guide you on this entrepreneurial journey kind of early on with getting clarity. And then you were able to be a very special part with the services you provided, a very special part of a personal family experience. So let's start. I'm teasing everybody now. They're like, ooh, what? Let's start with introductions. I'll have you tell everyone a little bit about yourself and what you do.
Okay, great. Again, so happy, Dr. Huntley, to be in conversation with you and speaking to folks on the Public Health Entrepreneurs Podcast. As Dr. Huntley said, my name is Tamara Mason. I'm an MPH, a certified health education specialist. I consider myself to be a public health professional, advocate, and researcher. In terms of my business is Mason Consultant Incorporated, LLC. And I do also work full-time currently at the Marginalized as a director of Maternal Child Health Collective Impact, where I'm striving to reduce inequities in preterm birth, maternal health, and infant mortality. I'm also, if we're still doing introductions, this is a very important part of my introduction. I am a mom. I have two wonderful children who keep us busy. Our son, Du Bois, will be 12 in August. He is named after W.E.B. Du Bois, so he has a lot to live up to. And then our daughter, Chloe Soleil, who is the true ruler of the house, and she will be 10 in a week, actually, on July 22nd. And then I am married as well. My husband, Kenneth Mason. We've been married for 16 years. So that's me in a nutshell.
Oh, wonderful family. Thank you for adding that in. And yes, Chloe, you can look at her in any photo and know that she is in charge.
Yes.
Oh, this is awesome. So, Tamara, I'd love to ask this next question just to kind of frame the journey. Our listeners may be thinking about where do they fit in? How do they create something? I think sometimes people expect there to be this linear path and things don't always kind of line up that way. So I love to kind of share the journey a little transparently when we talk on these and have these conversations and have a guest on. So when did you first become interested in public health as a career?
Yes, public health as a career, I would honestly probably say third grade, just in terms of health as a career, right? So since the third grade, after I discovered that I could not become the president of the United States because I was born in Jamaica and left Jamaica when I was 3. So I'm a naturalized citizen. So once I sadly learned that I cannot be the president because I'm not, born here in the United States, since the third grade, I've been saying that I want to be a doctor, specifically a pediatrician. I've always honestly loved people, love helping people, but particularly kids. And I said that, Dr. Huntley, and actually was on the path, the pre-med path, all the way through college. All my experiences, internships, honestly, were either two things: working with kids in some sort of educational capacity or, in a hospital healthcare setting, helping people. I actually did not become a pediatrician in college. I think it was like my junior year. I don't know if you want to call it an epiphany or what. I just decided that I'm not going to be a doctor. I'm going to do something else. And so I actually went and studied abroad in Ghana, West Africa, my senior year of college, which is unusual. Most people study abroad in their junior year, but I was like, if I'm not on this pre-med track and I don't have to do certain things for that pre-med track, I'm going to do the things that I want to do and then put off. And studying abroad was one of them. And the reason why I'm mentioning that experience is because that experience exposed me, even though I'm Jamaican and technically from a third world country, I'm going to a third world country, right? And focusing on health. My independent project was focused on health and alternative medicine. That just opened my eyes, I think, to public health, right? So before, I think it was more so medical, health related, healthcare. That experience, I think, started introducing me to public health. And then actually, when I came back, I became a teacher through the Teach for America program and taught for 3 years in New Orleans, middle school math and science. So I was a teacher at 21 years old in New Orleans in the late 90s. And I think it was really during that time, Dr. Huntley, that I was like, public health is what I want to do, even though I didn't necessarily have that language, right? But why that happened is because as I was teaching, and I really enjoyed teaching, still to this day, I say it's one of the hardest jobs, careers that I've ever had. But while I was teaching in New Orleans, marginalized community, I noticed that my students were not always able to be the best academic students they could be because of health concerns. So if Kentrell Wright is coming to my classroom with a throbbing toothache because his mom cannot afford to take him to the dentist, or, my other student is sitting in my classroom essentially hungry because there isn't enough food to go around at home before she comes to school in the morning, that impacts the type of student that they can be. And, now we have the language social determinants of health. We didn't have that language back then, or at least I didn't know it. But I knew those were connected, right? And I knew that it was impacting my students' educational journey. And that's what I wanted to impact, make a difference on. And somehow I arrived at, well, then I need to go get a master of public health. And I can solve all the social determinants of health, which I still wasn't using that language, right?
Yeah.
But that is my, I would say, like, official introduction to public health and that connection. And it's still connected to me, to education and public health.
Yeah, that's great. I love your journey because that does represent, and it's only really retrospectively that you can articulate it in this way, right? But that is what I hear often. That what I mean by it's not just so linear. It's not just I plan to do this and I do this next and then this happens. It's this path of discovery. Tell us a little bit more about what you do in your consulting business.
Yes, thank you. So Mason Consulting Incorporated LLC is a public health firm that we are focused on improving the health and well-being of marginalized communities. We do that specifically by giving power and a sense of agency to our clients with a focus on social justice and a health equity lens. And we provide a variety of services. We can assist our clients with community needs assessments, evaluating and designing curricula for their program. We also can do literature reviews. So some of those basic, like, core public health skills, right? We definitely can provide those services to our clients. We also do a little bit of event planning. We put on events here in Georgia, like a statewide Georgia Patient Navigator Conference. And really right now, where we are focused is in the maternal and child health space, which also dovetails with my full-time job. But I'm specifically providing, as a doula, a certified labor doula, compassionate and culturally competent care to families here in the metro Atlanta area.
Okay, so this is a perfect segue into the teaser that I told, about that personal connection with my family. So I remember when I actually had a group coaching program, and you were in that program, and everyone was trying to kind of adjust and pivot and deal with the pandemic and how it presented its challenges, which were just kind of unique for each person. During this time, we're all trying to adjust, and I was really encouraging you to be a little bit creative with doula services because you weren't able to go into the hospital, to the delivery rooms, and you were like, well, they're only allowing like one person, that's if that, and that's for like the spouse to be there, or usually the doula is not involved. So we came up with this idea of this virtual kind of coaching opportunity because I was very personally motivated by the fact that my oldest son and his wife were expecting their first baby, and she was already starting to have some like high risk type of issues. Tell us a little bit about how that experience, how we created that, and what that was like for you in your business.
Yes, and before I do that, I had to hype you up, Dr. Huntley, which I'm sure the people who are listening already know how wonderful you are. But for me, that was a pivotal point as an entrepreneur, right? As you mentioned, we are in the pandemic. I mean, we are in the heart of the pandemic. Even me training to become a doula, I trained to become a doula in the heart of the pandemic. It was like April 2020. So just all sorts of craziness all around, right? But fast forward to a year, it is now 2021. And as Dr. Huntley mentioned, doulas as support people, we are not allowed to go into the hospital setting because, which is understandable, the hospitals at that time were restricting folks due to COVID. And so being a doula in general is an in-person service, right? An in-person business. So I really was fretting, speaking with Dr. Huntley, like, I guess this business line of my business is going to have to be on hold because what can I do if I cannot go into the hospital and support my clients, the patients? Dr. Huntley was like, no, that's not necessarily correct. And I'm like, what do you mean, Dr. Huntley? Tell me more. She's like, what if you became a virtual doula? If you offered virtual doula services. So again, remember now we're in the pandemic, right? And so we are doing things virtually. We're meeting on Zoom, we're meeting on Teams. So I have to always give credit to Dr. Huntley that it was initially her idea. And then, together we worked for me to build that out. And it worked, which is, I don't want to say unbelievable, right? Because again, we're in the pandemic. People were doing other things virtually. But I think at first people were like, how can you be a virtual doula? How does that work? But you can be a virtual doula. And so I had the pleasure and the honor of being a virtual doula. And so this is the teasing that Dr. Huntley was doing of being in the virtual doula, my very first, honestly, client, but also virtual client. And to this day, really only virtual, truly virtual client to Dr. Huntley's son and his wife. And it was such a joy and a pleasure. And so we met via Zoom. So usually in person, right? I will do my prenatal visits in person. Of course, I support the client in labor in person, do the postpartum visit in person. And we just switched all of that to virtual. So I met, with Dr. Huntley's daughter-in-law and her son virtually via Zoom several times for us to establish our rapport, because that is the most important part of serving doula clients is that rapport, and you can still establish a rapport virtually. So, we had a couple of just get to know you sessions. And then now let's talk about, because as a doula, the way I practice, what I say to my clients is, I am here to help you have the birthing journey that you want to have. And in addition to that, especially the majority of my clients are Black birthing people and their families, we also want to make sure there's a safe outcome because of the statistics. But the birthing journey that you want to have, I'm here to support you. So let's talk about, what do you think of your birthing journey, right? How do you want this to go? What does your birthing plan look like? And we just had some really great conversations, again, virtually around that. And then in terms of the support, now this looked a little different because of how things played out, right? My client, she did end up having a C-section, but able to provide that calming support. I think that probably was the most important thing virtually to my client and her husband, and even to Dr. Huntley as the grandma to be, right? Their son will always have a special place in my heart. We were just talking about him before the official recording of this podcast, and I just love that family. Love that Dr. Huntley and I connected in this way, and that I was able to support them through, in general, what was a joyous time, but also an interesting time having a baby during a pandemic.
Yes, I love the story. I share it often, but this is just such a great, there's a lot of learning points from this, Definitely during that time, as you were looking at it from your view and your perspective, several learning lessons from that time period. I know that from your perspective, you were like, okay, well, I'm training to be a doula, and this is very in person because traditionally that's the way we've always done it. The pandemic taught us to be creative because a lot of us were struggling with, okay, this is the way we've always been done it. We can't do it this way anymore. Now what? And trying to figure it out. On the other hand, my son and daughter-in-law were pregnant and they were scared. And I mean, people were still having babies and they were scared. It was their first baby. She was tagged as high risk. And then, of course, my mama bear public health hats on. I'm thinking of all the poor statistics we know about Black babies. And I didn't want to be part of the statistic. And I was concerned and worried and all those things. But they were just scared. And there's certain things that, you don't want to necessarily. It's great to have mom. We have a good relationship. But they needed someone else in the mix, you know, and they needed someone else as their go-to there. I'm not a trained doula, and I can't provide them with that kind of support. So my problem solving is what we do as consultants, but you know, it's definitely my strength. So I started to kind of thinking like it was turning over here. I'm looking at this view, like they're scared. They need to talk to someone. They're limited. They don't know what to do. They don't have a comparator because they've never been down this route before. And here's this expert who's got, you know, this training and this, you know, so I just made the introduction. Once you and I kind of came with the idea, I just made the introduction. I'm not one of those to say, okay, you got to work with her and I'm not know your prices. I didn't even ask you about your package pricing. I just helped you craft an offer. And then I knew that that's part of that connection thing. I introduced you all and left it alone. I also knew of a male doula, Black male doula, William Moore, if you know him. And I introduced him to my son as a companion because he was like, I just, you know, that's what, it's only the only male doula that I knew of. But everything else just worked out like it needed to work out. I wasn't in the middle of it. And the funniest thing is you think it's almost hard for you to see the value in a way because you still kept struggling with it. For them, it was everything. They were bragging. I've got, you know, my doula went to Brown and they were just bragging about their, you know, the support they had and they were relaxed and I could be in grandma zone and not worry as much. And when she went into labor early, like they went really early. Jason spent 30 days in the NICU. I think he was maybe 6 or 8 weeks premature, about 8 weeks premature. But when they went into labor and everything happened so quickly and they were in the hospital, like you knew before I knew. The first call was not, I'm going to call mama. No, I got to call my doula.
Yes.
So a lot of really good learning lessons out of that. And I think that not only from us learning to think creatively and think about the value that we can provide, but your background is priceless. There's so much of your background that you pulled to that situation and that experience. And then, of course, I'm sure even though that you don't, that's like your primary focus is not virtual services. However, that experience has opened you up to possibilities and ways that you can create these hybrid experiences and work with people locally, right?
Yes, absolutely. Absolutely. And honestly, still to this day, because many of us have had the experience during a pandemic, right? It's like even with the in-person clients now, when we're supposedly quote unquote out of the pandemic, but everything doesn't have to be in person, right? Your clients, they're professionals, busy people too. And so sometimes it is more convenient to have a prenatal visit via Zoom or Teams. And it's okay. I think, again, prior to the pandemic, you just do things as you've always done things because you didn't have to be creative. And now we were forced to be creative. We tried it different and you're like, oh, this can work. And so you can incorporate pieces, right, into your business line. And I think that's part of being an entrepreneur, making that pivot however you need to in your business and continuing to do things that are successful.
Yeah. So I have a couple of more questions and then we're going to wrap up. It's kind of a two-part. I want to know kind of what you like the most, what you like the least about this journey. And this is about kind of keeping it real. What do you like most about consulting and this route, this path of entrepreneurship?
Yeah, that's a great question. I think, and we'll start with the positive first, right? What I like the most, just in general, is that you are able to serve and provide services to who you want to serve based on the niche that you're filling, right? And so for me right now, particularly being a doula here in Atlanta for majority Black families and birthing people, that's a need. That's my niche. And it feels really wonderful to be able to, I always say to my clients, because this is a whole other sidebar conversation, but I also want us to bring back joy into the conversation around birth and particularly for Black birthing people and families. So it is my honor, honestly, to support people during what is in general one of the most joyous times of their life, right? So that's a wonderful feeling. I think the most challenging, probably what many entrepreneurs will say, it's two-sided. So it's wonderful to, be your own boss, set your own target audience, set your pricing for whatever you're doing. But on the flip side of that, because you are your own boss, right, that hustle is real. And it's probably, I know for me, why I still have not stepped out fully and doing my business full time, because sometimes you're struggling with that cushion of, having the part-time or the full-time job, but also struggling with the level that you have to be at as an entrepreneur, right? To be able to sustain yourself just solely based on your business. It is a lot of work. You're always going to be working harder for yourself than anyone else, which is also a pro, right? So it goes together. But that hustle is real, and folks can get burnt out on it. And they're starting to be, which I think is good. I'm starting to see, support groups for entrepreneurs, resources around that, because it is important. And I think it should be an important part of any conversation as you're thinking about entrepreneurship, not to discourage you, but to be realistic.
Yeah, absolutely. I think great point to, reminder of like when I had the group coaching program, we talked about a lot of that, structuring those boundaries. And I no longer have that group coaching program, but we do have the mastermind program now. And that is providing that type of support and that guidance, exactly what you're talking about. It's necessary. It's easy for you to spiral out, and you will burn out very quickly without some guidance and structure. So thank you for that. I enjoyed catching up with you and so appreciate you sharing with everyone on this episode. I encourage everyone to connect with Tamara, and we'll share links in the comments. I'm going to add a little extra layer of guidance here. If you're looking for help on getting started with your business, please don't reach out to her for that. Reach out, we've got resources that can help you here. But what I am suggesting, if, part of her story, part of her care and her concern for maternal child health and her background and her expertise that she offers through her business, if that resonates with you, or interested in learning more about that, absolutely reach out to her. Consider her for any event where you need someone to speak or lead a workshop on, this topic. She's fabulous. She won't say that about herself. I'm going to say it about her. She is fabulous. And I hope that you will keep her in mind for those types of things.
Thank you so much, Dr. Huntley. I, again, always enjoy catching up with you, but also so appreciate your support still to this day as an entrepreneur. So thank you so much.
Oh, always. Thank you. And we will be in touch. We will definitely be in touch.
Yes.
All right. Thank you, everyone, for listening. And until next time, have a fantastic rest of your day.
Take care.
Thank you for listening. Visit publichealthentrepreneurs.com to learn more.